What's up, everyone? Steve here, your favorite physical therapist. What I wanted to do today was go over a very rare, but something that is important for you to know about, and that is infections following a total knee replacement. The first thing I want you to be aware of is just how rare infections are. As long as you're in the United States or most of Europe, the infection rates are about the same. In general, it's about 1% of total knee replacement patients will have an infection following their knee replacement. Now, there are two types of infections that we got to be aware of. There's a superficial infection, which is the infection of the incision and more on top of the skin. And then there's a deep surgical infection, which is an infection that develops around the bone and the prosthesis itself. The superficial infection, those are actually fairly easy to catch. You'll typically notice them in the first week or two. The incision is going to be bright red. It's going to oftentimes have some drainage that could be green or could be yellow. Most likely going to have a fever. You're going to have pain. You're going to have swelling. These are usually easy to catch as a clinician, as a patient, because you can look at it and if you see something green coming out of the incision, you're going to call up your doctor right away. You want to catch them early and catch them right away because they can become a deep surgical infection. Deep surgical infections are a much more serious problem. The deep surgical infections oftentimes won't show themselves until 1, 2, or even 3 months post-op. This can make them tricky to catch. What can also make them harder to catch is that some of the most obvious signs don't always show themselves. I can personally attest, I've seen 2 of them in my career, and both times those patients didn't actually present with a fever. What I will say is, personally, in the cases that I have seen, although the patient didn't present with a fever, what we did notice is a sudden regression in their overall progress. They had an increase in pain all of a sudden. They were having pain at night, difficulty doing the things that they were doing before. Both these instances were about 8 to 10 weeks after the surgery. And by then, the patient was resuming going back out to the grocery store. They were back in the community. They were walking around with a cane or with no device at all at this point in time. And suddenly they regressed. They had difficulty going out in the community. They were having a lot of pain at rest, a lot of pain at night. They were not as strong on that leg going up and down a curb or up and down a couple of steps to get in and out of the garage. So in general, what you would be looking for would be a regression in your overall function, particularly between weeks 4 and about week 12. Again, these are very rare. They're not something that happens, but it is something for you, and your physical therapist as well should be looking out for these symptoms. Everyone's going to have up and down days throughout their rehab journey. A bad day or 2 bad days or even 3 or 4 bad days is not the end of the world. However, if you begin to notice a consistent regression, and I would say pain that shouldn't be there because you're not partaking in an activity that should be causing you pain. So pain at night, pain at rest. It wouldn't be uncommon for somebody that's near week 8 or 9 or 10 to suddenly try new things. Maybe they try to go out to the grocery store, they try to do a significant amount of walking, and that increase in walking could cause them pain. Well, that would be an explained pain, but an unexplained pain would be something that I would be concerned about. The purpose of this video wasn't to scare you. If anything, it should reassure you because these rates are so low. Like I said, around 1%. So 10 out of 1,000 people are going to get an infection. Of those 10 out of 1,000, about 2 or 3 will be superficial, and another 6 or 7 actually will be the deep. So it's always a good idea throughout your rehabilitation process to check your body temperature. In the first 14 days after your surgery, you should be checking it almost daily. However, after the first 14 days, you can back it down to once a week or every other week. Just keeping an eye on it, making sure that it's not showing any signs of increasing. You can also decrease your risk of developing infection by helping to maintain a healthy body weight, controlling your blood sugars, managing your diabetes, and just eating an overall healthy diet. All of these will help decrease their chance of an infection, or if your body is beginning to develop an infection, help your body fight those germs off. So again, I hope you found this video helpful. If you enjoyed this content, please like, please subscribe. There will be a link down below for a guide to a total knee replacement, and we'll catch you on the next video. Thanks a lot.